I'm Chipkiri and on call. I hope I'm talking to Mike. According to your patient, Chief Complaint, you had a muscle sprain on your ankle, and I'm going to apply this crepe on your foot to retard the functioning of the muscles in your foot. So I'm going to. Are you comfortable? I'm going to be a bit touchy. Are you comfortable with that? Okay, I'm going to expose the limb, do some physical examination. I'm going to look for skin color change, ecchymosis, pain, no swelling, and then light palpation to look for pain. As you look at the patient's facial expression, deep palpation as you look at the patient's facial expression. Yeah. You're going to look for deformity if there is any malunion. You're going to look for crepe sound. Then that was deep palpation. In motion, we are going to assess extension, flexion. Now we are going to flex the patient's leg. We are going to extend the patient's leg. Extension and then flexion. In the ankle, we are going to do some movement to see if the joints were affected. We are going to do dorsiflexion and plantar flexions. Dorsiflexion, plantar flexion. That was motion or movement. Then we are going to invert the patient's foot, and then we are going to evert. This is inversion. Yeah. Then we're going to apply the crepe bandage from the medial aspect. We're going to do a 100 to 50 overlap above the affected area. So we're going to go for 100 overlap, and then from the middle side, you're going to go this side to the pinky, tiny toe. Yeah. This is 50 and a half, 1.5 overlap. We are observing the figure of 8. Make sure that your crepe bandage is so smooth. It should not have any creases because it's going to make the patient so uncomfortable. Make sure that the crepe is not tight because a tight crepe may cause compartment syndrome, swelling, skin color change. Yeah. When you're done tying the crepe, you press the toenails to check for capillary refill. Make sure the patient can move the toe fingers. Yeah. Advise the patient on the do's and don'ts when the patient is having the crepe. The patient, you're not supposed to expose the crepe or the crepe to water, because this crepe is going to soak water and it's going to be very uncomfortable for you. Make sure that when you're showering, you either tie it with a polythene. I think that's more effective. You tie it with a polythene. Make sure that you don't step. Make sure this right leg walks more than the left leg, because when you overwork this injured leg, there'll be more. Yeah, and then you thank the patient for cooperating. Thank you for cooperating.